Pursuant to the Illinois Opens Meeting Act, meetings held remotely will require roll call votes for all action items. To streamline, we've combined the action items into one combined motion, so only one roll call vote will be needed during the meeting. Will the secretary please call the roll?
Director Deere?
Deere is here.
Director Harrington? Is absent. Director Story?
Present.
Chair Ryder?
Here.
And for the record, those directors also present, Director Curry?
Present.
And Director Robinson?
Present.
You have a quorum.
Thanks, Debbie. Do we have any one registered to provide virtual oral testimony?
We did not receive any registrations.
Do we have any submitted written testimony to be included in the record?
We do not.
All right. We're going to move to the next item. The September 23rd, 2022 Finance Committee meeting minutes. These were approved by the board at the September meeting, but we're presenting them for the committee's review today for discussion if necessary. Are there any corrections that need to be made to the minutes? Does anyone have any corrections that need to be made to the minutes? Any corrections? All right, we're going to go ahead and hold
Mr.
these
Chairman?
then for the, yes.
Mr. Chairman? Good morning.
Yes.
I don't have any comments on the minutes. I would just like to acknowledge the presence of a new board member. Mr.
Okay.
Sam Robinson is the newest member of the Cook County Board of Directors.
Sorry, I didn't know that he was attending today.
Yes, he's on the call there. I see his name.
Okay. All right. Well, welcome to the committee. Are there any corrections? If not, we're going to hold these then for the combined motion to be heard later in the meeting. And moving on to the next item would be the items under the Chief Procurement Officer, but they're going to be the first set is the contract and procurement items. There's a total of 29. Number 5 is being withdrawn. We're going to have a number of different people present on these items, the executive sponsors. The first 4 are going to be presented by Dr. Lamar Hasbrook, the Cook County Department of Public Health's Chief Operating Officer. Dr. Hasbrook, you want to get started?
Sure, yes. Good morning, everybody. As mentioned, I have 4. So the first one is to execute a contract. The vendor is McKesson. This is a GPO. It's for $480,000. It's an ARPA-funded initiative, basically to provide generic naloxone for our opioid overdose prevention program. So it's pretty straightforward there. The next one, as we're queuing that up. Okay, so the next one is to execute a contract. This is new. This is going to be using SHI, also a GPO, which I think the board's probably familiar with. This is $331,000. This is to execute a service to create a eGrants, or electronic grants management system, also referred to as Gov Grants. And it will help us both in our role as a grantor, which is making grants to the community, making it more user-friendly, et cetera, but also as a grantee. And so this is going to move us forward in that capacity, and is in alignment with our community agenda to make sure folks have an equal access to compete for and apply to and manage the grants that we might make into the community. So that's that one. The next 2 are for the same amount of money, $250,000. They are contracts using corporate funds. The first one is Howard Brown Health. And they're doing the same scope of work, which is community-based STI screening, testing, and providing care and treatment as needed. Some of the board directors had some questions, which we provided to you both. But Howard Brown essentially has a network through Suburban Cook, and they work to do this that way through pop-ups and hyperlocal mobile clinics, etc. The next one is Color Health. And again, same scope of work. They are a California-based company, but they do work in a lot of jurisdictions across the country, and they work through schools primarily. And so they do the same kind of thing through schools primarily. So those are the four that I have, and happy to entertain any questions.
Any questions for Dr. Hasbrook? Right. If not, then we will move on to, we're skipping number 5. We're going to go to number 6, ambulatory services. Ileana Mora, will, our Chief Operating Officer for Ambulatory Services, will be making this presentation.
Good morning.
Ileana?
Yes, good morning. I want to present to you Hendrickson. We are looking to, as you all know, you have supported the expansion and building of beautiful new health centers in Arlington Heights, North Riverside, Blue Island, and of course the professional building. We are in need for the locations that have not, that are still within the health system, the community health centers, but have not had any renovation. They are in need of new patient chairs, waiting room chairs, as well as exam room waiting room chairs and the office chairs, task chairs for the staff. So this will help us with the furniture for those locations like Cottage Grove, Robbins, Englewood, Singstack, and the Stroger specialty clinics.
I think it's completely appropriate that people need to sit. Does anyone have any questions? If not, thank you, and we'll move on to items, let's see, 7 through 9, which are going to be presented by Dr. Rudy Campale, Medical Director, Stroger Hospital, for clinical contracts.
Good morning. So the first contract is a request to extend and increase an existing contract in amount not to exceed $296,652 for a 7-month period from beginning of May to the end of December 2022 with Impulse Credit Card Company for scope for maintenance of our existing. The contracts includes repair, refurbishment, of loaders, and also having technician. The second contract.
I'm having difficulty hearing him. I don't know if anybody else is.
Can you hear me?
Yeah, you just need to be, it's sounding a little tin canish, so if you can get closer to the microphone.
Okay, let me try switching the thing to my phone.
You're fine now.
Okay, so let me go over the first contract again. So this is a request to extend and increase an existing contract for a 7-month period from May through the end of November for an amount not to exceed $296,657 with the Olympus Company for scope maintenance. The maintenance includes, would also include repair and provision of loaners, and then also have an Olympus technician on site as needed. The second contract is a GPO, and this request is to amend and increase an existing contract in an amount not to exceed $87,696 for the remainder of the contract period through February 28, 2025. And this is with Richard Wolf Medical Instruments Corporation. And this is for the provision of platinum full service agreements for the servicing of our cystoscopes, rhinoscopes, and telescopes for the use by our urologists. And the third contract is a request to execute a new contract. We currently had a contract for the provision of micrographic surgery, more services for our dermatology clinic. And this new request is in an amount not to exceed $317,520 as needed for a 36-month period from December 2022 to the end of November 2025 with Dr. Alexander Kronek. This was a sole source contract, and these services are required by the Accreditation Council for Graduate Medical Education as part of the training of our dermatology trainees. Thank you.
Any questions? If not,
Mr. Chairman, I have just
Yes.
one question on the first contract. If we go back to the first contract, please.
Yes.
No, not the very first contract, just about the Olympus. Yes.
I think we've got Olympus up. Sorry, the computer went a little crazy.
Okay, thanks, Dad. Appreciate it. Just a quick question. Is this a contract extension for a defined period, or is it for?
Yes, we are seeking a 7-month extension. We had a contract from January 1, 2019, which ended April 30th, 2022. So we are seeking an extension to the end of this financial year.
What happens after the extension? Is this contract going out to bid?
It's my understanding that yes, we are seeking whether to, we are looking at various options. Are we still going to be going with Olympus? Or so we are in the process of working things out, whether we are going to continue with Olympus or we are going to look at somebody else. I know Dr. Rich King has been working very diligently on this, and we've been having discussions for quite a while. And I know Charles Jones and his team are also very much aware. Yes.
Hey, good morning. If I can jump in, Charles Jones, Chief Procurement Officer. We are transitioning to a new vendor, and we have their contract under execution. So no need to continue with Olympus. Thank you.
Okay, so this was competitively bid?
Yes, actually the renewal is the GPO vendor, just like Olympus was. Yes, it's a competitive purchasing methodology.
Thank you, Charles. Thank you, Doctor.
You're welcome.
just to make sure we clean this up so we can understand where we're at. Olympus is a 7-month extension, and as that one lands, a new one takes off. I have that correct, Charles?
That is correct.
Okay. All right. We're going to go ahead and move to items 10 through 13, which are going to be presented by Shannon Andrews, our Chief Equity and Inclusion Officer. Shannon?
Thank you, Chair Ryder. This is Shannon Andrews, Chief Equity and Inclusion Officer. Angela O'Banion, our Chief Information Officer, is going to speak quickly about Conica, and then I will take over the last 3. But I'd like to turn it over to the CIO, Miss Angela O'Banion.
Hello, this is Angela. Conica Minolta is our enterprise-wide printing, scanning, and copying system. And we are assessing our overall scanning and printing needs throughout the organization as the nature of work has shifted over these last few years. As such, we are continuing with the contract for this current year and are asking for an extension for an additional year, but we intend to put the contract out to bid to ensure that we have the proper assessment of our scan, print, and copy needs. And our new post-pandemic work environment with multiple devices, fewer people necessarily copying, more people scanning and using other types of electronic services.
Mr. Chairman, may I ask just a follow-up question real quick?
Sure.
Angela, what this next year, you're going to do a comprehensive assessment of all devices and usage of this modality. Is that my understanding?
That is correct, and we will be partnering also with the CIO of the county and other county entities as we continue for these common services to gain efficiencies enterprise-wide.
I would appreciate it, Mr. Chairman, if this committee could have an update, say maybe in the first quarter this, or maybe in March or April, about the progress of this, to just like to know that this work will be done in fiscal year 23. So if the record could address that.
Is the goal that we, that we're in a place where we've done the work to review what we should be doing going forward in fiscal year 23, or that we're going to have a new vendor or process in fiscal year 23? That way I know what you're requesting.
The goal is to have a new product or service prior to the end of this contract on October 31st, 2023. So the goal is to have something in place before this contract expires and execute any termination as needed.
Okay. All right. Noted. We'll look forward to an update. All right, thank you. Any other questions on this item before Shannon moves now into the next three? All right, Shannon, you want to take it away?
Thank you, Chairman. The next two items are really in pieces. The first is to extend and increase a contract with Housing Forward. This vendor is a not-for-profit organization that we've partnered with for 5 years to provide recuperative care for homeless households in a Housing Forward temporary site location in Oak Park. In addition to Housing Forward providing referral services for patients and clients from both Cook County Health and from our Cook County Care or County Care plan. This extension is for an additional 4 months, not to exceed $675,268, which will allow us to transition into a new contract with this organization that's being funded by ARPA. So again, this is a request to extend for 4 months, increase dollar value to allow for a closeout and transition into a new contractual relationship. And if there are no questions related to this, we can move to the next contract that's with Housing Forward, which will allow for a continuation of services as funded by ARPA. We are excited that we were able to receive funds to continue the amazing work that we've done in partnership with Housing Forward here. To be clear, the Respite Center provides a safe and secure temporary housing location for persons who do not need hospital or nursing care, but cannot adequately recover within a congregate shelter setting. Cook County Health, as you know, was recently awarded roughly $3.7 million to continue this work, and this new contract will allow us to have a contractual document that is in keeping with the requirements of the ARPA funding. The contract period for this would be from September 1st, 2022 through August 31st, 2024. Are there any questions related to the Housing Forward items?
I have a quick question. Have you seen the facility? Is this like a singles building, or is it part of a development? Can you just describe, just in quick fashion, what this physical structure looks like this?
Yes, actually, it is a hotel. It is a site that previously served as a hotel. Housing Forward is now responsible for a portion of that hotel. Cook County Health has staff and resources in that hotel to assist with those individuals who are in need of recuperative care. But the way to think, it's almost it's a hotel that's been turned into a dormitory type setting, if you will, that's located in Oak Park and services homeless individuals throughout not just the west side, but also the western suburbs.
Okay, I understand. So it's like a hotel. So we provide food and security, et cetera, all for the residents of Howard Forward.
Those services are provided there at that location, and we provide the medical care in partnership with Housing Forward.
Thank you.
Any other questions?
I have a question, just quickly. Are we working, or is there someone working within the homeless specifically on transitional services?
Yes,
Once they're well, assume they leave there and where do they go?
Well, we work hand in hand with Housing Forward to ensure, and quite frankly, there are a number of partners throughout the Cook County land area that we partner with to try to ensure that individuals who leave this site are provided stable housing options. Again, Housing Forward is our subject matter expert in this, and they've been wonderful partners. The work is currently being led out of our organization by Shante Gamby, who is serving as the interim housing director.
Thank you.
And
Yep. All right, go ahead, Shannon. Keep going.
Thank you, sir. And with that, the last item that I have before you is to execute a new contract with the Medical Research Analytics and Informatics Alliance, also known as MARIA. This contract is not to exceed $40,961. It is a grant-funded contract, grant-funded by IDPH. This organization is a not-for-profit subgrantee who partners with the Illinois Department of Public Health to collaborate with healthcare systems, public health departments, and federal healthcare agencies to host these registries. This subgrantee agreement is in keeping with the grant award received from IDPH to ensure that all of its healthcare partners are aligned and tied into to the same system. And so this contract will simply allow us a vehicle to pay for our partnership in that collaborative. And if there are no other questions, that is the last item for me. Thank you.
All right. We're going to now move back to Angela O'Banion, who's going to go over items 14 through 22 for health information services.
Hello again. As was stated, we have a number of items that I will proceed through. The first is being presented to you is Interlace. Interlace is our the request allows for the continued use of our enterprise informed consent electronic signature solution. The software is integrated into our electronic medical record, and its use has reduced manual and paper processing and improved improved our compliance and efficiency, but it allows for the electronic signature of both patients and clinicians in the consent of surgical and other procedures. No questions there. The next item is for Altos Healthcare Services. This request before you is to continue to fund our Altos contract, which provides over 100 staffing positions that provide ongoing IT staffing, technology, and process system support. These resources represent the core of our ability to technologically function. This annual contract cost is an increase over prior years, primarily resultant from additional resources and services to support pandemic and post-pandemic initiatives, which are now part of our routine day-to-day life. For example, one such factor that resulted from the pandemic is the need to support an increase in the number of end user devices, which is sometimes known as bring your own device or BYOD. That has expanded. People now not only have a desktop, but they may have a mobile device, they may have an iPad, and all of these additional expansion of devices come with the expansion and extensive use of applications. And those have increased more than threefold since 2020. And in addition, some of our learnings post-pandemic highlighted the need to continue and actually accelerate our maintenance and upgrade improvements that will require staff to deploy to sites, such as the refresh that we are undertaking of over 3,000 aging desktop laptops and other such devices. I'm happy to entertain any questions on this particular procurement, which we intend to keep in place, that we intend to have this procurement out to bid beginning in January, because we will need a long lead time for whomever is the awardee of this solution, just given the size and scope of the number of staff augmented positions we are discussing. The next item is our McKesson system, which this request allows us to continue the use of McKesson as our pharmacy point of sale software, hardware and software solution. It's the main driver of the pharmacy retail operations. The next request is for NetApp. Each of these CDW GPO competitively bid items that you will see are annually renewed. NetApp is a software that helps us manage our cloud services, which is listed down as Azure, which is the Microsoft brand name for cloud services. You have the service, and then you have items to help you manage that with your different environments. Next, we have something that's a little different than the rest, which is our Gartner subscription-based services. The Gartner subscription-based advisory services allows us to dig deep into products and services for the organization, to have discussions with experts on various systems and best practices and technology, whether they be cloud management strategy or creating personas for people's desktops, to the best cost model for technology and other resources. Many people know Gartner from their 4 quadrants, but we have access to all of the people who author all of the advisory services and articles and research at Gartner. The next product is for F5. This is another piece of technology that we use to help load balance our servers throughout our environment, to make sure that we are able to see the traffic on our servers and move traffic between servers to ensure that we are operating efficiently. And that is what this F5 product does, as you see through our GPO competitively bid contract. InfoBlocks is also a tool that helps us see and manage the devices that are connected to our network, whether they be domain names, which sometimes is known as DNS, domain name services, or other appliances. This tool just enhances some of our core Microsoft technologies to provide support in managing these services that are accessing our network. Microsoft Defender is a additional product that we are buying for our Microsoft Enterprise Agreement. It basically allows us to actively manage security on our Office 365 platform. We have an increased use in technologies such as Teams and some of the other Microsoft products. And this additional Microsoft Defender, as it sounds, provides cybersecurity, additional cybersecurity protection. Our Cisco agreement. Cisco is the heart of our networking solution, whether it be our telephone services network management, or it is the smart boards, the boards in our conferencing room. SmartNet is the name of Cisco's maintenance and support services contract. But this contract is really the core, the continuation of the use of this contract is really the core of our network environment. Cisco, Microsoft Enterprise agreements, those are the two master things that overlay everything that we do in the organization, and Cisco is integrated into all of those services. Thank you very much.
Thank you, Angela. We're now going to move to item 23, being presented by Valerie Amos, our Chief Human Resources Officer. Yes?
Mr. Chairman, I don't have a question for Ms. O'Banion, but I would like to just acknowledge that she, in this new role, I'm impressed with the work that she has set forth for her and her team in fiscal year 23. There's some major initiatives that she has opted to take to the market, and I'm very impressed with the fact that she stepped into a new role and is pressing for changes, that things that have been in place, like this contract for $33 million since October 28, 2016, that she's addressing one of the concerns that this board has had for the last 15 months about major contracts that have not been competitively bid. And I'd just like to compliment her and her team for their go forward strategy around some of these major initiatives in IT. So thank you, Angela.
Thank you, Director Story.
I'd also, I mean, we can across the board, I think, we've done a good job of revitalizing the organization and, making sure that we're looking at everything we're doing, with a fresh set of eyes. And, Angela and the rest of the team that our CEO has built over the course of the last 2 years, I think, has taken us to a whole new trajectory. So, thank you to Angela, to Israel, and everyone else under the umbrella for really stepping up, especially coming out of such a difficult 2-year period.
Absolutely, I concur,
right.
Mr. Chairman.
Let's, Valerie, are you ready?
I am. Good morning, everyone. This is Valerie Amos, Chief Human Resources Officer. Thank you. I have one contract before you, which is to extend and increase the value The total value is $600,000 that I am requesting. The purpose for this contract is for executive level searches. We have a number of executive level searches in play. And so this is an MWBE facility, Carrington and Carrington, that has been supplying services to assist us with some of those complex searches. The contract period that I'm requesting is to extend to October 31st, 2023. That's it.
All right, any questions on that one? All right, we're gonna move on then to item number 24, which is gonna be presented by Dr. Bina Peters, our Chief Nursing Executive, and Dr. Arnold Turner, our Chief Hospital Executive. I believe this is for nursing at Providence Hospital.
Thank you, Director. Good morning, all. This request is presented for consideration for the purchase of equipment and installation services for a new nurse call system and overhead taking program at Providence Hospital. The new system will immediately improve the patient care, staff communication, and the services delivered by allowing for a better communication throughout the hospital. The current system are outdated and obsolete, and this purchase is part of a long-term solution to replace the nurse call system to meet the Joint Commission and also IDPH standards. Any questions?
Just want to add that this will also solve some of the issues we have in communication, particularly through our overhead paging system, because there are some areas that we might consider dead spots, and this system will address all those. So it adds another level of patient safety also. Thank you.
Thank you. We will move on to request number 25 through 29, which are being presented by Craig Williams, Chief Administrative Officer, Operations and Development.
Great, thank you. Good morning. The first one is an extended increased contract with Alverno Labs. Currently, our staff and equipment only process urgent studies in histology, with the remainder going to Alverno, who is able to turn around the slides in the next business morning. This is a 12-month extend for a total of $1,814,576. Okay. The next two are related. They're both related to our environmental services departments. The first is an amend, extended, increased contract with Executive Building Maintenance, known as EBM. EBM provides staffing in our environmental services for when we have vacancies, and this would allow them to continue that service. This is a 6-month extension while we are working on issuing an RFP for overall environmental services at the hospitals. Okay. The next is also related to environmental services, an amend, extended, increased contract. It's a 6-month extension with ABN Healthcare Support Services. ABM provides leadership services to our environmental management services team. And so this would be to extend that contract while we're developing that RFP, with the goal of trying to reduce the amount of outsourced spend we have with environmental services. Okay. The next is within our pharmacy. It's a new contract that was done through our GPO. It's a 3-year contract totaling $900,000, and it's to provide TPN pharmaceutical solutions through central admixture pharmacy services. Okay. And my last one is also a new contract that was done through an RFP. It's a 3-year contract totaling $210,000 with Barton Carey Medical Products. And this vendor will provide custom-made burn compression garments that would be prescribed by a physician. Thank you.
Thank you. All right. Moving on to our last one, we're back to Dr. Turner, who's going to handle request number 30.
Good morning. Thank you, Director. This is for equipment for our operating rooms, including operating room surgical lights and tables and their accessories. This is a GPO contract. It also includes an extended service plan for these items. We are Provident. We're expanding our surgical services. We're now doing on an average about over 300 cases a month. That's something that has not been done for years at Provident. We have additional service lines that we plan to bring on, which include urogyne and neurosurgery. These tables will allow us to expand to into those remaining operating rooms and furnish the lighting for those, which one we intend to use for cystoscopy later in the future, which will allow us to do an additional 1,000 cases a year. So this will help us continue our program expanding surgery cases at Provident. And the surgery that we do here is mainly ambulatory. So becoming the ambulatory surgical center for the Cook County Health System. Thank you.
Thank you. Now, Charles, do you have any other comments for any of the things, any of the reports we just heard?
Yes, sir. Good morning again, Charles Jones, Chief Procurement Officer for CCH. Of the 29 items that was presented, all 29 require responsive letters from the Office of Contract Compliance. We have 5 back with 24 outstanding.
All right, great.
Thank you, sir.
Charles, it's my understanding that you're ready to report on our monthly report on minority and women-owned business enterprises participation.
Yes, sir. Debbie, if you can scroll over all the way to the right for August. So we're presenting for the month of August. There was 45 contracts that was brought before you. Of those 45, 12 had contract-specific goals. The others were 0 goals. So of those 12, about a little bit shy of $14 million worth of opportunity there. 3 of those contracts were prime. The minority vendors were prime for $4.6 million and 33%. 6 of them were subprime subcontractors, a little bit over $1 million there for 7%. 3 waivers doing for the particular month of August. The inventory management system and automated replenishment order system contract for $2.4 million ended up in a full waiver. And also the leasing of the Pyxis equipment for supply and inventory dispensing systems contract for $2.1 million ended up with a waiver. And then finally, the annual life safety assessment contract for $610,000. So those 3 totaled up to the $5.1 million you see here with the 3 waivers. All in all, the month of August came in at roughly 40% participation. Looking at the last column to the right for year to date, 75 contracts and a little bit over 433 million, almost 435 million. 9 of those have been prime vendors with 10.1 million, 44 subcontractors. So 53 different minority vendors in total for a little bit over $18 million. I'm sorry, $118 million of participation there for roughly 25%, 27%. Next chart, Debbie. And there you see the visual with the bar graph for August. 40.5. For this, I'll pretend to be financial and say 41%. I'll round that up to 41%, and 27% year to date. Any questions on the MWBE metrics?
Oh. Right, hearing none, why don't we go on to the report of emergency purchases, Charles?
Okay, for the month of September, we had 6 emergency purchases. Presented that notification to the board, Chairman of the board, Chairman Taylor, and Chairman of Finance, Chair Ryder. First one was AB Staffing, 6-month contract to provide emergency temporary supplemental staffing services for the radiology department of the system, $1.5 million.
All right, Charles. We're gonna hold the items, the contract procurement items that we heard from earlier for the combined motion. Charles, you don't have any other reports, correct?
Yeah, I'm sorry, Chair Wright. It was 5 more. We have 5 more before.
Oh, I'm sorry.
That's okay.
I'm not looking at my sheet. I'm looking at all my other notes. Sorry. Go ahead.
Yes, sir. No worries there. AM Workforce, a 6-month agreement to provide specialized temporary resources for trauma registry and trauma process improvement, $259,000 there. Convergence Technology, 12-month contract to provide immediate fire sprinkler work and inspections for Stroger Core, Providence, and the CCH clinics, system-wide, I should say, $185,000 there. Six-month contract with Daniel Yeager to provide physician locum tenens services at Providence Hospital to support the ambulance runs, $993,000. Hill Mechanical, 12-month contract, similar to the other ones, to provide immediate, in this case, immediate fire control system testing and fire extinguisher inspections for the entire health system, $307,000. And then lastly, the contract with Kaufman Hall and Associates for a 3-month agreement, consultants services for the system certificate of need application on behalf of the New Providence Hospital, $350,000. Any questions? Director Story. You're on mute, sir.
My question is just a clerical one. Debbie, are these did you send emergency purchases out to the board?
Director Story, I do believe, I'll double check in my emails, but I believe they went out with the agenda and materials that went out last Friday.
Thank you, ma'am. I'll check my emails then. Appreciate it.
All right, thank you, Chair Ryder. That ends my report.
All right.
Presentation.
Awesome. Otis, your hand is still up.
I can't hear and I can't see. What's wrong with me?
There you go.
Thank you.
All right.
Thank you, Mr. Chairman.
No problem. No problem. Next up are reports from our Chief Financial Officer, Pam Casara. I believe, Pam, your first report is going to be an action item on the receive and filing of grant award related items.
Thank you, Chair Ryder. Good morning, everyone. Pam Casara, Chief Financial Officer. You are correct. The first item is informational. They receive and file Cook County Health grant awards and renewals. For October, you can see we have a total of $1.444792 million. All are renewals that have been previously approved by the county board. And I believe the executive responses may still be on if there are any specific questions. Hearing none. The second item before you is also a receive and file informational transfer request that'll be going to the county board, 9.761 million. As in prior months, you can see on the left side there, we are taking from salary surplus dollars and put from various departments and putting them to registry services on the right side. Any questions on that item?
Just that we continue to work to actually fill those positions, so
Absolutely.
we're less reliant on having the transfer funds to cover registry.
Thank you. Moving on to the financials. Next slide, Deb. So for the 9 months ended August, I'm pleased to report that CCH ended 6.7 million positive variance to budget on an accrual basis, and we are 204.4 million positive variance on a cash basis. The key items driving that remain pretty much the same. Year-to-date revenues better than budget due to some catch-up payments we've received from the state on the hospital side, and then also the higher capitation on the county care side due to the higher membership. On the expense side, we continue to have a year-to-date negative variance to budget in purchase services, expense being partially offset by that salaries and wages surplus that we just spoke about. And the county care claims expense is also greater than budget due to the higher than budgeted membership. Next slide, Deb. There you can see the actual financial statements. Again, total revenue 83.2 million over budget. Total expenses 75.6 over budget. You can see those red numbers there indicating negative variance to the budget. However, a very positive bottom line, 47.5 million, the budget being 41 million year to date, so 6.7 million over budget, better than budget year to date. Next slide. So on the volumes that drive the revenues on the hospital side, you can see we continue to lag behind budget, but are doing better than prior year to date. The variances continue to be greater on the outpatient side. However, the last few months, July, August, and September, we've actually had pretty strong months on the outpatient side as well. You can see the numbers very much closer to last year numbers. Next slide. And this is our graphical depiction again of the climb back to sort of that pre-pandemic 2019 level. In some cases we're there, and we're just not quite hitting what we budgeted for this year. Next slide, Debbie. Payer mix as well, that pause on redetermination during the public health emergency, allowing for the patients to retain their coverage. And you can see the Medicaid continuing to climb and the uncompensated continuing to go down over the last several years. Next, I'm going to give a shout out to our Chief Revenue Officer, who is also going to present a slide here shortly. But they've really improved significantly over the course of the last year with their revenue cycle turnaround plan, meeting on all goals with the exception of AR days and AR greater than 90, which are in the yellow. However, you can see that orange line starting to trend back down towards the blue line, which is the goal. Next slide. Similarly with denials, also green in 2 boxes as denials continue to trend down, hitting the goal on the net final denials, less than 2% of cash collections, and then continuing to trend down on the quarterly government denials. Next slide. And now I'd like to invite Chief Revenue Officer Curtis Haley to speak to a price increase we plan to do this coming fiscal year.
Awesome. Thank you, Pam. And good morning, everybody. So I want to start off with a little history here to kind of paint the picture. Last year, when I completed the assessment of RevCycle, one of the outliers and discovery items was that we had not adjusted our prices since 2010, about 12 years. So knowing that, we did an analysis in the market, see where our prices landed compared to the other health systems within the Chicagoland market, And no surprises, our pricing gap was pretty significant, the variance between what the average pricing was and what we were charging. So we developed a policy and then also a strategy to review our CDM, our prices on an annual basis, and adjust to the limit of our payer contracts, which is about 4%. And last year, when we ran the model to see where we can get the biggest bang for our buck on that 4% aggregate price increase, it turned out to be that room and board and surgical rates was the way to go. Last year, we brought in roughly about 4.1 million annually in additional reimbursements, and still had a variance after that adjustment to the market pricing. So we're going to continue with that strategy this year as well, which will bring that variance down from last year. I believe it was over 40% to the high 20, low 30% variance, which doesn't get us out of the woods yet, but it gets us closer to being more competitive, which in return will bring in about 3.8 million this coming year in additional cash. And we'll continue to monitor this and adjust as needed year over year.
Great. Thanks, Curtis. Any questions before we move on for Curtis? All right, next slide, Debbie. This slide shows our trend over time on our charitable and public program expenditures, and not just including the traditional charity care, which has trended down about 10 million a year over the last several years, but also all the other public programs that we have in place. Next slide, Debbie. Once again, another shout out to Curtis and his team. While we did not budget for those revenue cycle improvements in the FY22 budget, we are achieving them, almost $5 million year to date. We've gained from the revenue charge master, payer contracting, charge capture, and vendor contract renegotiations that we've been working on. But hitting also on all the rest of the areas, primarily vendor contract negotiation we've been working on this year. So 9/12, so the goal would have been at 75%, and we are at 77%. Next slide. And then county care, 6.2 million gain year to date. Their budget 26.9, so running behind budget at this point in the year. However, that is both, as mentioned previously, the revenue and the claims expense are both higher than budget due to the higher than budgeted membership. Next slide. And then more care, 5.2 million loss, budgeted for 7 million loss. So actually losing less money to tune of $2 million, which is great, while we continue to wrap this up in anticipation of exiting at the end of the year. Next slide. And that is the end of the financial presentation.
Any questions for Pam? Anything she just reported on? Right. Hearing none. Let's see. That brings us to the end. Except for we have one more report. But we'll do that after we do the motion. So I would now ask for our combined motion, which would be a motion to accept item 3A, the September 23rd, 2022 Finance Committee meeting minutes. Approve item 4A, contracts and procurement items containing requests number 1 through 30, with the exception of request number 5, which was withdrawn, and subject to completion of review by contract compliance. Receive and file item 5A, the grant award related items, and receive and file item 5B, the transfers of funds. We will need a roll call vote on this. Is there a motion?
So move, Mr. Chairman.
Motion's been made. Is there a second? Motion's been made, properly seconded. Any discussion on the motion? Hearing none. Debbie, will you please call the roll?
Roll call on the combined motion. Aye or nay, Director Deere?
Aye.
Director Harrington?
Aye.
Director Story?
Aye.
And Chair Ryder?
Aye.
You have 4 yays and 0 nays.
All right. Our last item on the agenda is going to be a report, which is an update on the VIA contract for contract management and nurse registry services, which is going to be presented by Dr. Peters and Mr. Jones. Charles, Bina.
Good morning, directors again. Thank you. We will, this presentation, this is our biannual report to the board on update on VIA. So we will cover the contract scope, implementation benefits, and also the FY22 year-to-date usage. And some of the agency recruitment challenges which continue to be, faced by across the nation, and also county recognized NBWB usage. Next slide, please.
Bina, you're hard to hear right now, so I don't know if you sound muffled.
Let me adjust the voice. Can you hear me now?
It's slightly better.
Okay. Also, I will speak loud. So I shared this with you in the past, this VIA contract, this is our 3rd year of the contract. The purpose of the contract was to supplement nurse staffing to cover our vacancies as well as to address the emergent staffing needs, example, the COVID, the monkeypox. And so it is to supplement the existing workforce to provide safe quality care. Also via contract provide contract management services for all the nursing and support staff positions across Cook County Health System. Next slide, please. So these are the notable benefits through this contract. Due to COVID, CCH staffing needs increased by 400% starting FY21. And also with this contract, we were able to expand the number of vendors to support the staffing need from 6 to 49. And prior to this contract, the agency records fill rate was approximately 30%. Now we are up to 93% with this contract. Also, with this contract supported to streamline the contract management process, including the invoicing. And the VIA has allowed the pool to recruit to meet the urgent and immediate staffing needs. So we did use this contract to meet the immediate staffing needs projected by COVID, and they were able to meet it. And also all qualified agency providers by MDWB vendors were accepted, 100% accepted. So just a comparison, in FY21, the VIA provided approximately 173 FTEs worth of agency support. In 22, it is 449. Also, if you look at what that means by the total number of agency staff onboarded to support this needs in 21, 1,500, and 22, it is 1,600. Because there is an increased turnover of travel nursing across the country, and we are faced with the same thing. So while we are, turning over the agency staff at the increased pace, they are able to provide the backfill to provide safe quality care. Next slide, please. Also, just to give a high-level update on, we do have, the number of, nursing vacancies, which, every day, nursing and HR are working closely to fill the gap. Meantime, we are using agency to cover the nursing vacancy gap. When I say nursing vacancy, that is not only just the RN, this is nursing support services, include the tech, the PCPs, and other positions included in these numbers. Next slide, please. So we continue to, as we are using agency staff to provide safe care, there are also challenges. Increased nursing needs across the country, especially due to the COVID, the post-COVID, that is seen by many health systems across. Increase, again, there is a huge demand and a nursing gap. So, lots of article about that, the nursing staff demand increased significantly. High agency turnover, I mentioned the one, they sometimes are turning over from 8 to 10 weeks. Increased demand for travel agency staff. Across the nation, there is a 240% increase in the agency travel agency requirements or the availability. Due to higher attractive compensation, you can speak for Cook County, overall our cost increased, hourly rate increased over 200%. Also, in 2021, across the nation, the nursing turnover is also increased. Nationally, it is 23%. And however, that one area we are doing much better than the national average. We are somewhere 13%. Also, the nursing workforce is, nearing the retirement, and I think that also reflects the Cook County staff. They are also faced with the projected 20% more retirement in the next 3 to 4 years. So lots of challenges. However, we are using the agency staff right now to provide safe care. Next slide, please. With that, I'm going to turn this to Mr. Jones to share the VIA vendor report.
Thank you, Dr. Peters. So here, as Dr. Peters has said, we've gone from 6 contracts with 6 vendors to over 49 vendors now with VIA. What you see before you is a listing of those particular vendors. Those highlighted in yellow are MWBE vendors certified with the city of Chicago and the county of Cook. So by going this route, we've shifted the relationship from prime vendors to subcontractors with VIA. However, we've been able to retain all of the services from those particular vendors. Here they have switched out one vendor from last report quarter. Trust Staff Travel Nurse LLC here is a new vendor brought on as they cycle out other vendors. Next slide, please. And the main takeaway from this particular slide is this is with all our minority vendors. Advanced Care Services at the last quarter is tracking 13,683 hours. Core SAE LLC, 1,434 hours. Professional Nursing Inc., 6,949 hours. And the Nurse Agency, 8,472 hours. So over 30,000, almost 31 hours logged between the minority vendors the last quarter. And as you look at these last 4 reporting quarters, we've been trending upwards every quarter. Any questions? All right, here none. Back to you, Dr. Peters. You're on mute, Dr. Peters.
Thank you, Mr. Jones. This slide is to demonstrate the trend in the nursing hourly rate based on the demand. So if you look at it, the RN rate went, our initial contract was with the $70 an hour, and that rate went up to $205, and now it is back to $150. I think we work closely with the vendors bi-weekly to assess the market trend nationally, locally, and also at the Midwest level, so that we are adjusting the rate accordingly, and also allowing the nursing agency to join our system based on the market rate. So, and also that similar process is applied to non-RN physicians. If you can see the major non-RN physician is the nursing assistant physician. Again, the market is increased in the past, and it is came down to $50 an hour. So this is an ongoing process. Next slide, please. So that's the end of the presentation. Any questions or comments?
Any questions or comments, Dr. Peters? Or for Charles?
It's just a tremendous challenge, and we appreciate all the hard work that you guys doing, Dr. Peters and Charles and the rest of the staff. Well, I'm grateful. I'm grateful for your efforts. So thank you.
Thank you, Director Story.
Right. Hearing no other questions or comments, that brings us to the end of the meeting. Our next meeting is scheduled for Friday, November 18th at 9 a.m. With no other business and having exhausted the agenda, the meeting is adjourned. Thank you.